Come back. In this video, I will discuss cytomegalovirus infection (CMV). It causes infections in those who are immunocompromised, like HIV positive infections, and also it causes congenital infections. So, it is a major cause of congenital infections also. And also in the patients who have organ transplants and are immunosuppressants, those are also the target of cytomegalovirus. Cytomegalovirus belongs to a herpes virus family, also known as human herpes virus 5. It causes a latent lifelong infection. So most of the patients have this latent lifelong infection, but this only expresses in those when they are immunocompromised. Here you can see owl's eye appearance of the cells because of presence of these inclusion bodies. Modes of transmission. It can transmit to you through saliva, urine, semen, breast milk. So, milk can also cause transmission of this infection. Blood transfusion. So, screening of blood transfusion should be done, especially when you are donating the blood to the immunocompromised. And in case of organ transplants, you should also screen for CMV because patients are immunosuppressed in case of organ transplantations, and there is a risk of this infection, especially leading to organ transplant rejection. It can also be transmitted from the mother to the fetus in transplacental route. Clinical presentation. In case of immunocompetent individuals, it is usually asymptomatic or it is latent and leads to even mild illness also. It produces a mononucleosis like syndrome in which there is fever, malaise, lymphadenopathy, and atypical lymphocytosis. Atypical lymphocytosis as is seen in the infectious mononucleosis caused by Epstein-Barr virus. But in immunocompromised individuals, for example in HIV patients and in patients who are on immunosuppressants due to organ transplant, these patients have severe disseminated cytomegalovirus infection. It can cause damage to your eyes, that is visual loss. And on fundoscopy, you will see a pizza pie appearance of the fundus because of hemorrhages and necrosis. Because of hemorrhages and necrosis, you will see a pizza pie fundus appearance. Also, you will see pneumonitis in immunocompromised individuals, leading to cough, dyspnea, and hypoxia. Pneumonitis, retinitis, pneumonitis. Also, especially who are having inflammatory bowel disease and who are on immunosuppressants can develop CMV colitis. CMV colitis leads to abdominal pain and bloody diarrhea, and it is diagnosed on flexible sigmoidoscopy. So, sigmoidoscopy is done to check for CMV colitis, especially in IBD patients. It can also cause encephalitis leading to confusion and seizures, and hepatitis, bone marrow suppression, etc. can also be caused by CMV in immunocompromised patients. The most important thing is congenital CMV infection. It occurs due to maternal primary infection during pregnancy, and the symptoms in newborn include, most commonly these are growth restriction and chorioretinitis. Also can lead to blueberry muffin, pinpoint petechia. These appear like blueberry muffins. And also jaundice, hepatosplenomegaly, microcephaly, small skull, intracranial calcifications, and sensory neural hearing loss in children who are exposed to CMV during pregnancy. So it can lead to jaundice, hepatosplenomegaly, microcephaly, intracranial calcifications, sensory neural hearing loss, growth restriction, chorioretinitis, and blueberry muffin skin lesions. Diagnosis. It can be diagnosed through serology because IgM is produced in acute infection against CMV, which can be detected, or IgG can also be detected that shows a past exposure of CMV. And also PCR can be done to detect the CMV DNA because it contains double-stranded DNA. Also, it can be detected in the blood, urine, and tissues. So, in different secretions of the body, it can be detected. Also, histopathology can be done. Biopsy is taken when it shows owl's eye intranuclear inclusion inside the cells. Owl's eye. Here you can see owl's eye intranuclear inclusions inside the mononuclear cells. Especially mononuclear cells are its targets. Mononuclear cells. So, histopathology shows owl's eye intranuclear inclusions. Fundoscopy shows retinitis finding, as I have told you, hemorrhage and necrosis leading to pizza pie appearance. Management. In immunocompetent individuals, you don't need any management. It is a self-limited condition and no specific antiviral is needed. Only just supportive therapy. Like for fever, you can give Panadol. In immunocompromised individuals who have severe disease, then antiviral therapy is required. Ganciclovir is the drug of choice. If someone asks you which is the drug of choice for cytomegalovirus, it is ganciclovir, especially in retinitis when there is eyes involvement, or valganciclovir. Ganciclovir is IV drug while valganciclovir is oral drug. Both are same. Alternatives are foscarnet. When there is resistance to this ganciclovir, then foscarnet is used. Cidofovir can also be used when there is resistance to ganciclovir. Supportive care for organ specific damage should be done, and you should monitor viral load during treatment. In case of congenital cytomegalovirus, we give oral valganciclovir for 6 months after delivery of the fetus to the newborn. It improves hearing because it causes sensory neural deafness. So hearing is improved when valganciclovir is used for 6 months, and also neurodevelopmental outcomes are also improved when you give valganciclovir for 6 months when the baby is exposed to cytomegalovirus. So this is all about cytomegalovirus infection.